have with us our expert, Dr. Narender M, Senior Consultant Plastic Surgery, and he'll be discussing all your queries on breast reduction surgery. Doctor, here are a few questions from our viewers on breast reduction surgery. I'll start with the first question. What is a breast reduction surgery? And there's a term called reduction mammoplasty. If you can describe that.
Hi, thank you. Good afternoon. So, yes, breast reduction surgery, as the name suggests, is surgery done to help women who suffer from the problems that come with having heavy breasts or breast enlargement. So, in breast reduction surgery, this excess breast tissue that they have is removed in a symmetric, planned manner so that we produce smaller, lighter breasts. Essentially, women who come to us with complaints of heavy breasts, breast enlargement, they have problems associated with this, and it typically manifests as constant dull aching pain, a dragging sensation that's there, especially in the lower neck, upper chest, and the shoulder regions. And this is typically worse as the day goes by. Um, they also often have complaints of the bra straps, which are like jutting into the shoulders, and also will frequently have a rash on the undersurface of the breast. So, with all these complaints, when they come to us, that's when we consider them for breast reduction surgery.
Okay, so how big do the breasts need to be to get a reduction? And is there a specific criteria for this?
So there are no specific criteria as such. The moment they become symptomatic, where they have these complaints that just elaborated, when they feel that the breasts are too heavy and there's constant dull aching, dragging type of sensation, and they feel quite uncomfortable with it, especially as the day wears on, and when they have frequent rash on the undersurface of the breast. So these are all the symptoms for which we consider breast reduction surgery. Also, women will find it sometimes embarrassing in situations where they try to do workouts in a gym, or finding appropriate clothing. So, for all these different reasons, we consider breast reduction surgery.
So is the process, the entire procedure painful?
So, contrary to public perception, breast reduction surgery is fairly less painful compared to most of the procedures. In fact, we find that after the surgery, the pain medication is the requirements are very low, and people are very comfortable. They are able to get back to more or less regular activity in about 2 to 3 days after surgery.
Okay. So, doctor, are there any side effects of this surgery?
So this surgery is very safe, and there are no side effects as such. As with any surgical procedure, there are a few potential risks, and in this too, as in any procedure, there can be the risk of wound infection, minor dehiscences. But barring that, this procedure is very safe and has no serious adverse effects.
Okay. What about the age limitation? Any specific age, or for what age this is suitable or not suitable?
So there are no specific age criteria again. Moment the breasts have grown to such a level that they cause symptoms. So that's the time that we do the surgery. So it can be done for anyone in their late teens to anyone in their 50s also. Anyone who's suffering from this symptoms associated with heavy breasts.
Okay, doctor. So, in terms of the surgery, do you categorize this as aesthetic surgery or a clinical surgery, or maybe a mix of both?
So this would more fit into the category of a reconstructive surgery, as it helps to get rid of excess body tissue that is causing constant pressure, constant weight over the chest. So that's more of a reconstructive procedure, but also it helps to improve the aesthetic appearance of the breast at the end of the surgery. So, and helps to improve a lady's self confidence from this. So it has some amount of it is also aesthetic, but it's predominantly a reconstructive procedure.
Okay. So, but is there, apart from the procedure, is there also a natural way, apart from the surgery, to deal with the breast reduction?
So there is no natural remedy for breast reduction as such. There are popular misconceptions people have that they think that breast reduction has come only because of fat, and therefore some people resort to dieting and to working out a lot in the gym. So these things don't work, and eventually we find them coming. Eventually seeking the surgical route. There is no medication either to treat this. This is the only solution for this is surgery.
Okay. One question and concern that a lot of women have is that will they be able to breastfeed after the surgery?
So that's a question that we get very often, and there are no definite studies which have looked at it to give a concrete answer. However, from a theoretical point of view, even in a breast reduction surgery, while a significant chunk of breast tissue is removed, there is a good amount of breast tissue which is preserved in its original condition. So we believe that even after breast reduction surgery, a woman should have the ability to breastfeed.
Okay. Also want to understand if there's a risk of recurrence in these cases.
So, when breast reduction surgery is performed relatively early for someone with, say, breast hypertrophy, which has happened relatively early, like in the early teens, and so when we do the breast reduction surgery early in life, subsequently when they go on to get married and after childbirth and breastfeeding, there is a small risk of recurrence in those people. But by and large, the vast majority don't have a recurrence.
Okay. And is this procedure covered under medical insurance?
So, since it's primarily a reconstructive procedure, it is covered under medical insurance, especially when the breast reduction is significant and women are suffering from constant back pain, neck pain, shoulder pain, and surgery is done to relieve those symptoms, then definitely it is covered under insurance.
Okay, doctor. So we are almost towards the end of the session. The last question I have is, how should a patient choose a surgeon while planning to undergo a surgery?
So to choose such a surgeon before this is if the surgeon can explain to them in detail the various steps, show them good amount of pre and post-op images which clarify this, give them a clear understanding of it, and they have good experience, and especially if they are trained, if they've done a fellowship in this, that will be even better, even more ideal.
Okay. With this, we come to an end of today's live show. Thank you, doctor, for your valuable inputs. And thank you, viewers, for joining us. If you have any queries, you can leave a comment and our experts will answer for you. Thank you.
Thank you. Thank you.